We were kind of thrust in the limelight a year and a half ago or so. We were taking care of this little 8-year-old girl with medulloblastoma, that's a brain cancer. And the parents just questioned the use of continued chemotherapy after she didn't have surgery to remove it. And then they came to me and said, we don't want to do any chemo. And I said, well, we're going to do our whole program. Started on our whole program. And then the parents have said, well, I don't know if we want to do any more chemo, because the oncologist said you need to do all this other chemo, and we need to do full spine, full brain radiation. And the parents just said, I don't know if we want to do this. When they got home, there was a sheriff at the door with Child Protective Agency. People don't realize it, but your children are not your children in the United States. There is not a state in the United States that can't do the exact same thing to you. Once you're in the system, if you don't follow the quote-unquote standard protocol, you are in hot water. You are declared an unfit parent. They threaten that not only will that child be taken away and put into foster care and be forced to do the chemo, radiation without you present, but also her older sister will be taken away because you're going to be declared unfit parents. So the mother ended up doing the chemo, doing the radiation, though we pushed her down to Chicago where they had a unit that used a little bit less radiation. We negotiated that. But our local news station, KARE 11, came out and did a little bit on her and interviewed me because I was helping her. And then the state medical board came down my neck. So they don't like me. So they still don't like me. We still get letters from them.